Hi everyone. We're going to give people just another minute or so to sign on and then we will get started. Thank you very much. Hey, welcome everyone, and thank you so much for joining us for today's webinar, Helping Caregivers Create Enabling Environments for Successful Aging in Place. Before we get started, just a little bit about us. We are the National Center on Family Support. We're based out of Pittsburgh and funded by a grant from the Administration for Community Living and the National Institute on Disability, Independent Living, and Rehabilitation Research. Our mission is to partner with government, academia, and the family caregiver community to transform research into services and programs. Our goal is to improve the care, health, and quality of life of people with disabilities and the families that support them. We're very excited for today's webinar. Our presenters today will be discussing what aging in place means, how caregivers can create environments that allow people to successfully age in place, and resources to support them as they do so. Today's webinar will be recorded, and everyone who registered will get a link to view the recording in their email within the next few days. For any questions that come up throughout the webinar, please feel free to either put them in the Q&A or the chat windows in your Zoom screen, and we'll cover them at the end of the presentation. Right at the end of the presentation today, everyone should receive a survey, and we would really appreciate it if you would fill it out to help us improve our future programming. Today, we will be joined by Beth Fields and Ann Miller, both from the University of Wisconsin-Madison, and both have a great deal of information and knowledge to share with us today about aging in place. I'm going to turn the presentation over now to Beth and Ann.
Before we get started, we would both like to share a little bit more about ourselves. As an occupational therapist, I've worked in home health and skilled nursing facilities. In addition to being a formal caregiver, I have also been a family caregiver for my grandmother, pictured on the left side of the screen. As my grandmother's dementia progressed, I was able to help her find ways to continue to engage in meaningful activities. I also helped my family think about ways to make her home environment more safe.
Hi everyone, my name is Anne and I am an occupational therapy student at UW-Madison. I just finished my second year. For over the last 10 years, I have worked with children, teenagers, and adults with disabilities in their homes and in community settings. As a soon-to-be OT, I have a strong interest in working with older adults and their families in a home health setting to promote safe, productive, and independent aging in place. I have also provided assistance to my mom, pictured on the right, who has a degenerative neuromuscular disorder, as well as considerable mental health challenges and PTSD. I often provide her with emotional and psychological support and collaborate with my siblings about how to best care for her now and as she ages.
By the end of this webinar, our goal for everyone is to be able to identify some contextual and environmental factors that influence successful aging in place for older adults, apply strategies to help older adults realize their goal for aging in place, and lastly, be able to locate some available resources to support aging in place. To meet those learning objectives, we will first review caregiving and aging in place, transition to discuss the concept enabling environment, share definitions, examples, and considerations for physical and social environments, as well as context. We'll apply these terms and ideas using a picture activity towards the end of the presentation. And lastly, we'll save some time at the end for a brief summary and time for questions and answers. And I want to note during our presentation, if you think of a question, please feel free to use the chat box to type in your question, and Anne and I will make note of those so we come back to them at the end. Before diving too far into content, I'd like to first share the definition of caregiving that our webinar is based upon. A family or informal caregiver is any relative, partner, friend, or neighbor who has a significant personal relationship with and provides a broad range of assistance for an older person or an adult with a chronic or disabling condition. As many of us know, caregivers take on many responsibilities. These responsibilities can occur periodically or on a day-to-day basis. Responsibilities can include, but are not limited to, self-care tasks such as bathing, grooming, toileting, or feeding, healthcare tasks like making and attending medical appointments, helping fill prescriptions, and even completing some more complex medical and nursing tasks like wound care. Caregivers also help older adults with household tasks such as chores, maintenance, and financial management. As my grandmother's caregiver, I was able to help her fulfill many of those daily activities so that she could age in place, one of her personal desires. Aging in place is the ability to live in one's home and community safely, independently, and comfortably, regardless of age, income, or ability level. Related to aging in place, a recent report from the AARP found that 76% of people want to remain in their current residence, and 46% believe they'll stay in their home and never move. In 2017, CUSATO reported several descriptive statistics related to barriers to aging in place. 41% tripped or fell, resulting in injury. 37% experienced physical barriers for simple household tasks. 23% had inability to access part of their home, and 21% made fewer trips outside due to difficulty entering and leaving their house. Adapted from a dementia model created by experts in Washington, an enabling environment is one in which a person can lead as full and independent life as possible. Successful aging in place depends upon an enabling environment. We know that as people age, they are likely to experience memory loss, perception changes, including vision and hearing, poor concentration, as well as changes in balance and strength. It is thus critical that we take into consideration simple modifications using key design principles in order to create an enabling environment. There are several evidence-based design principles that really serve to maximize this term enablement. One principle is to unobtrusively reduce risk. This principle signifies that people require an internal and external environment that is safe and easy to move around if they are to continue to pursue their way of life and make the most of their abilities. All safety features must be unobtrusive. Some unobtrusive features, especially for those with dementia, can include fences or locked doors, which can lead to frustration, agitation and anger, or even apathy and depression. A second design principle is the need to provide human scale. This principle aligns more with an independent living facility situation in which an older adult may have their own apartment or condo, but also share some common spaces with other community residents. The experience of human scale is influenced by three factors. One, the number of people that the person encounters. Two, the overall size of the building. And three, the size of individual components of the building, such as doors, rooms, and corridors. A person should not be intimidated by the size of surroundings or confronted with a multitude of interactions and choices. Rather, the scale should encourage a sense of well-being and enhance their competence. Another principle is managing levels of stimulation. The environment should be designed to minimize exposure to stimuli that are not specifically helpful to the older adult, such as unnecessary or competing noises, or the sight of clutter that are of no use to that older adult. The full range of senses must also be considered. Too much stimulation is as stressful as too much auditory stimulation. And the final principle I'm going to share today is the need to support movement and engagement. Purposeful movement can increase engagement and maintain a person's health and well-being. It is encouraged by providing a well-defined pathway that is free of obstacles and complex decision points, which guide people past points of interest and opportunities to engage activities or social interaction. The pathway should be both internal and external, providing an opportunity and reason to go outside when weather permits. I'll now turn it over to Anne to share more about the physical and social environments and context.
Thank you, Beth. The first type of environment we're going to discuss today is physical environment, which includes the natural and man-made surroundings in which we engage in our daily activities, such as walking paths, hills, apartment buildings, furniture, trees, and everything else we are surrounded by. When thinking about the physical environment of the older adult's home and what might make their lives easier or harder, some things you may want to consider are if there are any steps to enter the front door or get to a basement, if there are sturdy railings on both sides of those stairs, if there is any furniture they have to walk around to get from one room to the next, if there are any rugs, cords or clutter on the floor, if the bedroom, bathroom, and laundry room are all easily accessible, and if there is ample lighting throughout the home, such as between the bedroom and bathroom in the middle of the night. This is by no means an exhaustive list, but more of a starting point to begin thinking about the physical challenges the older adult may face in their home. To start thinking about solutions to these physical challenges, we'll discuss a few examples and potential solutions. The first example, which is very common, is when an older adult is no longer capable of safely going up or down the stairs to enter or leave their home. A common solution for this problem is to install a ramp that bypasses the stairs. There may also be a different entrance to the home that does not have stairs, but would require a change in routine, which is not always easy. The solution could also be as simple as installing sturdy railings on both sides of the stairs for the older adult to grab onto. It really depends on their personal needs and abilities. The second example is when the bathroom doorway and the bathroom itself are too small for a wheelchair to navigate. One solution, which is not always financially feasible, is to remodel the bathroom with a bigger doorway and more open space to navigate a wheelchair. If the older adult is able to use a walker with some assistance, a caregiver could help the older adult use the walker to enter and use the bathroom. Properly installed grab bars in the shower and near the toilet would be really helpful in this situation. Another example is when there's not enough light in the kitchen for the older adult to read cooking instructions on a package. An easy and inexpensive solution is to install battery-powered puck lights under the cabinet to illuminate the countertops. Another type of environment that is important to consider is the older adult social environment, which is the presence and expectations of and relationships with persons, groups, and populations with whom the older adult has contact. This can include caregivers, family, friends, spouses, and neighbors, as well as the availability and expectations of those people in their life. When thinking about the social environment of the older adult's home life and what might make their lives easier or harder, some things you may want to consider are if they are married and live with their spouse, if they have any family who live nearby and could offer some assistance, if their family members support the idea of them aging in place, if they have any friends nearby who could offer some help, and if the older adult provides care for someone else in their life. To start thinking about some solutions to social challenges the older adult might face, we'll discuss a few examples again and some potential solutions. The first example is when an older adult stops driving because their family insists on it, but not because they can't do it. A potential solution would be to contact the older adult's doctor to get a referral for a driving assessment with a driver rehab specialist or an occupational therapist with specialty certification in driving and community mobility. This would make it clear to the older adult and their family if, when, and where they should be driving. If you're unable to get a driving assessment, another solution could be to have the older adult drive only on familiar roads and during the daytime, particularly if nighttime vision is impaired. Again, the best solution will really depend on the older adult's personal wants, needs, and abilities. The second example is when an older adult with memory issues often repeats herself and changes topics during conversations. This can be frustrating for family and friends, especially if they do not know about or understand the older adult's memory issues. A potential solution for this could be to educate their family and friends about these memory challenges and how important it is to be patient and understanding. It's also helpful to explain that memory issues change from day to day and even from hour to hour. Gently redirecting the conversation could help it get back on track. or maybe it's best to call back later that day or the next morning. Another common example is when an older adult is reluctant to accept help from others. This happens with my mom quite frequently, and she's definitely where I got my hard-headedness from. A potential solution can be to approach conversations by actively listening to the older adult's wants, needs, and concerns, and try coming up with a creative solution that makes both you and the older adult happy. Another approach is to model good behaviors, such as talking about how good it feels to have the house clean and free of clutter, and to also talk about ways in which you need help too. This may encourage the older adult to be more accepting of help for themselves as well. Context is also important to consider in addition to physical and social environments. Context includes elements that are often less tangible, but still have a strong influence on our ability to engage in daily activities. Some contexts to consider include cultural, personal, and virtual, such as societal expectations based on age and gender, with activities such as caring for grandchildren, driving, and managing finances. Level of education and the ability to understand written materials, income level and the ability to make home modifications, and the prevalence of virtual interactions, such as especially now during this pandemic. Start thinking about some solutions to contextual challenges the older adult might face. We'll again discuss a few examples and potential solutions. The first example is when an older man insists that he wear his suspenders every day, but he no longer has the hand dexterity or strength to button them. A possible solution could be to have him try putting the suspenders on his pants before he gets dressed, and he could use a button hook for this, and then pull the suspenders up over his shoulders after he puts his pants on. If he is open to the idea, he could also try using clip-on suspenders. A second example is when an older adult gets prescribed some new medications but is unable to afford them. One solution could be to ask their doctor or pharmacist about potential generic options that might be more affordable. You could also look into different prescription drug plans that might cover more of the drug costs, such as a Medicare Advantage Plan Part C, which already includes prescription drug coverage, or a Medicare Prescription Drug Plan Part D that adds drug coverage to other Medicare plans. Another example is when an older adult wants to interact with their grandchild on Zoom, but they don't know how to do it. One solution could be to talk them through the process over the phone while they set it up and help them to problem solve when they run into issues. Another solution could be to join the older adult in person for their first Zoom chat to walk them through the process and explain how to use the program. These next two slides include a list of links to resources that can help you make sure that the older adult's home is set up for successful aging in place, as well as provide you, the caregiver, with information and resources you may need to care for the older adult as they age. The AARP Home Safely Checklist can help you determine how well the older adult's home meets their needs and what areas may need some improvement. The next two links, if you follow those, you can learn more about and find your local area agency on aging and Aging and Disability Research Center. The Caregiver Corner provides information and resources for caregivers and answers their frequently asked questions. The Family Care Navigator provides an extensive list of services, programs, and resources, both nationwide and for each state. Follow the link and select your home state to learn more about what's available near you. The National Family Caregiver Support Program funds various supports that help family and informal caregivers care for older adults in their homes for as long as possible. PACE, which stands for Program of All-Inclusive Care for the Elderly, provides comprehensive medical and social services to Medicare and/or Medicaid beneficiaries who are living in the community. This program is only available in states that offer PACE under Medicaid. Follow the second link to find your state and a link to the state's website. The National Rehabilitation Research and Training Center on Family is located at the University of Pittsburgh and works to translate state-of-the-art research and training into services and support programs to improve the care, health, and quality of life of all persons with disabilities and the families who support them. The Family Caregiver Alliance provides a central source of information on caregiving and long-term care issues for policymakers, service providers, media, funders, and family caregivers nationwide. The National Alliance for Caregiving is an objective national resource aimed at improving the quality of life for families and older adults. The Caregiver Action Network provides education, peer support, and resources to family caregivers nationwide free of charge. Next, we thought it would be helpful to get some practice using example pictures from the Enabling Environments website. We're going to start with the bathroom because most falls in the home occur in either the bathroom or the kitchen. In the interest of time, we're only going to discuss the 5 things that are circled on this picture. But if you want to learn more, you can find a lot more information by following the link at the top of the page. The first thing I want to point out is the handle on the door. If the door handle is a color that contrasts with the color of the door, it makes it much easier to locate, especially for older adults with low vision. It is also important to ensure that doors are unlockable from the outside in case of emergency. Similar to the door handle, it can also be really helpful if the toilet seat is a color that contrasts with the rest of the toilet to ensure that the seat is easily located. Next, when installing grab bars in the shower or near the toilet, make sure they are securely fixed to the wall. Each one should be able to support at least 250 pounds. If the older adult has low vision, it can also be helpful if the grab bars are of a contrasting color to the wall. For electrical sockets, either use covers for the sockets or consider switching to outdoor waterproof sockets. Also be sure to use a residual current device because the trip switch will prevent electrical shocks, especially in wet areas such as the bathroom. Lastly, it is important to ensure even lighting throughout the bathroom so the older adult can easily locate the things they need to safely and successfully complete self-care activities in their bathroom.
Thank you, Anne, for sharing all those wonderful links to helpful caregiving resources. I would now like to practice a similar activity. This time we're going to review a dining room. So similar to Anne's previous slide, I'm going to review some physical and social environmental modifications and contextual. Again, I'm only going to describe the circles in the picture. Circle 1 illustrates how music can be a welcome source of positive sensory stimulation, or it could be a negative source of overstimulation. Manage the stimuli in the environment by controlling the type of music played, the volume, or by turning off music if it is too distracting for the person. Also, be sure to help choose music that has meaning to the person. Circle 3 depicts the use of plain, brightly colored dishes that will contrast well with placemats and tablecloths, as well as with the food on the plate. This may be particularly important for those older adults with visual impairment. Circle 4 emphasizes the need for furniture, such as dining chairs, that are comfortable with good back and arm supports. Sturdy furniture can help older adults with poor balance and strength transfer more easily. Circle 7 illustrates the importance, again, of lighting. It's important to have diffuse, localized lighting above tables to supplement general lighting. A minimum general light level of 300 lux is desirable. And lastly, Circle 8 represents how plants and flowers can bring a natural sensory stimulation into the environment. This can really serve to brighten up the atmosphere indoors through color, texture, and fragrance. I also want to review a couple of common concerns in the kitchen, as Anne previously mentioned that falls frequently occur in this room. Circle 1 represents the need for fixtures to be easy to use. Make sure hot and cold water faucets are clearly labeled to help prevent injuries, and that the knobs are easy for the older adult to turn on and off. In addition, you may want to consider water flow monitors, flood detectors, and pressure activated plugs to help reduce incidences of flooding and water-related slips and falls. Circle 3 illustrates the importance to ensure tiles are non-slipped. You may want to consider using a non-slip treatment on ordinary tiles to make them slip resistant. Circle 5 depicts a common safety concern in the kitchen, the stovetop. If the stovetop is proving to be a hazard, especially for those with memory impairments, consider replacing it with a safer induction stovetop. Other safety devices include a safety cutoff switch on the main power board, stove isolation switches, safety electrical cords, gas detectors, and gas cutoff switches. Circle 10 signifies how you can help older adults access important and frequently used items by placing them on the kitchen benchtop or an open shelf. And lastly, Circle 12 highlights how a whiteboard can be used to note what is in the fridge or pantry, and can also be used to track shopping lists, reminders, and important messages, especially now during a pandemic, when you're scheduling more FaceTime, Skype, or Zoom calls with close family members or friends. So in summary, today, Anne and I have shared background information on caregiving, aging in place, and some ideas for creating an enabling environment. Be sure to turn to that list of resources for more information on how physical and social environments, as well as contextual considerations, can support your efforts in helping older adults age in place. That brings us to the end of our presentation. We want to thank you all for your time and attention today, and we'll use the rest of our time for question and answers.
Thank you so much, Beth and Anne. At this time, we would like to ask that anyone who has questions, please pop them in the chat or in the Q&A. These can be questions about the presentation or questions about maybe the environments in your own lives that you have questions about. We will be emailing out these slides to everyone today, so you will have access to those list of resources, but also invite you to ask any questions that you have now while Beth and Anne are still with us. We have a question about barriers to leaving the house or property for people with memory issues and how that can cause anger or agitation. Are there any other suggestions that either of you have about that?
Thank you for your question, Heidi. So it will really depend on the older adult that you're helping care for. But one thing that I found helpful with my grandmother, she was progressing through dementia stages, is finding ways to distract her from those doorways. And also some institutional care facilities will even put like wallpaper or other ways to blend the doorways that are more barriers to, or I should say act as barriers and can cause issues around safety for their loved ones that may have issues with wandering in particular at certain points in the day. So those are a couple of suggestions that I have. Anne, do you have any others?
Not anything that comes to mind right now, but if I think of anything, I can certainly send Heidi an email if she wants to share her email with us.
There's a question about any, if any of the resources that you shared can provide information regarding financial and income requirements for home modifications.
Financial aid.
Yeah, great question, Heather. So depending on the state you live in will really depend on what resources are available. So Anne on her resources pages in the PowerPoint had like links to state lists for you to check and see what you can take advantage of. So one that comes to mind is the National Family Caregiver Support Program, which states are if caregivers of older adults enroll in that program, they can take advantage of services that range from like Meals on Wheels if you're not able to afford certain, if you have issues paying for certain food, they also, and transportation, they also have resources related to handymen in some of those programs where they'll contract with local handyman in your area. So I would first check out the state links in the web or in the slides in our power presentation. And if there's a particular state that you live in that you're not sure of what resource to turn to, Anne and I are happy to connect with you after the webinar to answer specific questions about how much money could be provided to help support some of those larger home modifications, like installing a ramp, for example.
For anyone in Pennsylvania, the Pittsburgh area, I think we do have an answer from someone in the chat who works at a local program called Family Links. And if you enroll in the Caregiver Support Program, they offer a $2,000 home modification grant to everyone in the program. So we will make sure to email that information out along with the slides. Beth, can you talk a little bit about the Capable program?
Yeah, thanks. I just saw Heidi's comment. So thank you for bringing that up, Heidi. So I am actually involved in the RTC on family support through the University of Pittsburgh, and I am one of the co-principal investigators on a project that is looking at adapting and implementing a community-based program that that's designed to help older adults age in place. And the program is called Capable, and it was developed at Johns Hopkins by Sarah Zanton and her team. And we are currently looking at ways in which to include caregivers in that program, and then also ways in which we can implement this evidence-based program into a local area agency on aging as one of the services that they can provide. So a little background on Capable, because it's very relevant to helping older adults age in place. Capable, like I said, is an evidence-based program, and it consists up to 10 home sessions where occupational therapist, nurse, and handyman work together to figure out solutions to help the older adult successfully age in place. So an occupational therapist actually comes into your home during one of the sessions and goes through a home environment or safety evaluation with the older adult. And then we'll complete a work order and share it with the handyman to come in then after the OT has visited and complete those home modifications. Right now, Capable has been implemented in several states and has been studied and shown to reduce costs for older adults through Medicaid waiver programs. So most of the home modifications that have been looked at in previous studies of Capable have been up to $1,300 as part of the different agencies that are delivering Capable. But with that money for the home modifications, it does show that it helps reduce institutionalization, other healthcare costs like hospitalizations as well.
Great, thank you. I am not seeing any more questions pop up, so I am going to turn our presentation back on and then turn this over to Heidi to send us out.
Good afternoon, everyone. I want to thank you all for being here. We have a little bit extra time, and so I'm actually, if people will bear with me, I'm going to ask people for their input on future programs that you would be interested in receiving in this series. What are some other questions you have about family caregiving? What do you wish you knew tomorrow? It would really help us be able to plan these monthly seminars. Heather, are we able to unmute people to give people a chance to ask questions? Or do we keep everyone muted and they do it all through the chat?
We may have to do it all through the chat, but let me.
Heidi, since I'm able to unmute myself, I'm curious to learn if you've come across, or anyone involved in the center at Pitt has come across, any helpful resources in helping explain how to use different virtual platforms like Skype, Zoom, you know, WebEx, etc., to older adults if we're not able to be there in person with them and walk them through the steps.
That's a great question. And I think we'll try to put some people on that and try to make those public. I think it's such a challenge to be able to support older individuals through using this pretty complex technology. Heather, do we have people open, or should we ask people to chat, use the chat feature?
I am making my way through and allowing people to talk. So
okay,
people
great.
should be able to start unmuting themselves and making comments out loud if they would like. And of course, anyone is welcome to type into the chat or the Q&A as well. Everyone now should be should have their microphone available to them.
Thank you, Heather. Yeah, we'd love to hear people's thoughts.
Hello, this is Janice Wrench in Kalamazoo, Michigan.
Hello. Thanks for.
Hi. I would love to hear a good discussion about supporting your adult child, no longer a child, but your adult offspring living in your home. My son has Duchenne muscular dystrophy and is currently a master's student and lives back here at home. He did go away to college, but he is back here as he needs more physical assistance. And I think we've got the physical part covered, but there's so much more to it about being able to support him socially and how that looks, and when it's in your own home, and really trying to giving him some independence, but it is also your home, so the whole question gets a little bit complicated. And I would really love to hear some ideas about that, or know some resources that could help us.
Great. That's a fabulous topic. We will definitely look into getting some experts to speak on that and gathering some resources as well.
Good.
This is a reminder to join our mailing list, which I think is
yes.
we get an opportunity to do that on the survey. And we will definitely put this on our list. We are building this coming year's programming, and it sounds like a fabulous topic.
Thank you.
Mm-hmm.
We do have a question/comments in the chat about programs that offer technology available for caregivers, such as an iPad or some other device.
That's a great question, Beth. And
yeah, I am actually not aware of any program at the state level that would be able to use the funding that they receive for their caregiver focused programs to purchase iPads or some other devices. However, in the midst of this pandemic, you know, that's a great thing to think about, and I think something to share with administrators and leadership within those state-run agencies to see if there is a flexibility in how money can be spent to support caregivers in a time where you're not able to go out and you're having to do so much of your caregiving virtually. So I will explore that question a little bit more and see if there's any policy that's being explored right now to support offering tech to caregivers.
That's great. Thank you, Beth.
Great question, Mary.
Are there any other questions or suggestions? All right, well, you will have an opportunity, you always have an opportunity actually, by going to our website or emailing us at caregiving@pitt.edu to give us suggestions about what you'd like to hear about or to ask questions. We are here for you. I would like to take this moment to say on behalf of our team at the National Rehabilitation Research and Training Center here at the University of Pittsburgh, to thank our speakers today, Dr. Beth Fields and Ann Mueller. They really did a nice job of putting together a very clear presentation, and I think have given us all a lot to think about regarding ways to improve the environments where our older loved ones live, to enable them to live more safely and independently. And now I'd also like to thank each of you in the audience for attending this webinar, and thank Heather Tomko for our programming. Again, we'll urge you over and over again to complete the survey that will come to your email inbox later this afternoon. It's an essential way for us to be able to track our services and the interest in what we do and to improve our services. It also gives us sort of a mark of accountability to our funder, which is very important as we put together our reports. So thank you again for choosing to spend an hour of your time with us today. We hope you all are safe and well and continuing to stay at home and find ways to be creatively social from the confinements of your safe home. So have a wonderful afternoon and thank you again.